Hi, my name is Alyssa. I chose sepsis for this project because back in January my family had COVID and my papa was sent to urgent care because of some situations that arose, and they said he was possibly septic, which interested me in the topic. In the United States alone, sepsis causes over 200,000 deaths annually. Additionally, sepsis is the second most common infectious cause of death in the U.S. So what is sepsis? Sepsis is the invasion of sterile tissue by one or more microbial pathogens with a resultant systemic inflammatory response. In most cases, the pathogen is not identified, and depending on the case, the pathogen varies. Some common pathogens include Staphylococcus aureus, Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitis, Klebsiella pneumoniae, Escherichia coli, and Group B streptococci. The picture below is of the Staphylococcus aureus as an example. So what are some signs and symptoms? A high heart rate, low blood pressure, confusion, disorientation, extreme pain, discomfort, fever, shivering, feeling very cold, shortness of breath, clammy, sweaty skin. Who's at risk? Adults who are 65 and older, people with weakened immune systems, children younger than 1, people with chronic medical conditions, and sepsis survivors. Here I included a video that will help explain the basis of sepsis.
Homeowners, this incredible tip is just for you. If you owe less than $331,760,
Here I included a photo to help explain the pathway of infection in sepsis. First, the local infection is caused by bacteria. Second, the bacteria enters the bloodstream. Third, the immune system responds to fight the infection. Fourth, bacteria and immune cells spread throughout the body, causing uncontrolled inflammation. Fifth, this may lead to organ damage and death if left untreated. So what is the mode of transmission? Sepsis can be caused by fungal, parasitic, or viral infections. A few sites and types of infections include in the abdomen, an infection of the appendix, which is appendicitis. There can be bowel problems, an infection in the abdominal cavity, which is peritonitis, and gallbladder or liver infections. In the central nervous system, infections of the brain or spinal cord. In the lungs, infections such as pneumonia. In the skin, there can be bacteria that enter the wounds. And there can also be conditions such as cellulitis. In the urinary tract, you can have UTIs. Sepsis is caused by bacterial infections, and it is not contagious. Diagnosis. So how does a doctor diagnose sepsis? They look at the high and low white blood cell count, a low platelet count, acidosis. If they take a blood culture and it's positive for infection, and abnormal kidney or liver function. What are the treatments? It's best that you get a quick diagnosis so that the infection doesn't spread. The steps for treatment is first to identify the source of infection. Second, to get blood and urine tests, get x-rays and CT scans. And third, to give antibiotics. And in some cases, IV fluids are administered or vasopressor medications. In cases of organ failure, the patient will receive the appropriate care. For example, if their kidneys are failing, they will have kidney dialysis. People who have had sepsis in the past have a higher chance of getting it in the future. The prevention. To prevent sepsis, you must wash your hands, be up to date on vaccines, have routine medical care, and seek medical attention immediately if any symptoms arise. Here I've included my URLs for my information sources and the picture URLs.